My name is Lauren Eichert, and this is my head-to-toe assessment for the spring 2026 semester. This is my patient Wyatt. I'm going to start by scanning the room. I'll start with the ceiling, the room, here's my supplies, the floor. Okay. So when we start, we're going to be assessing the skin. We're going to assess that throughout the exam. We're going to be looking at color, which is normal for ethnicity, temperature, which is warm, looking for any moisture. We're going to look at the texture, looking for any edema, looking at skin turgor, looking for any bruising, swelling, lesions, nevi. We're going to do that from head to toe. We're going to be looking at the skin on the scalp, head, extremities, posterior and anterior chest, abdomen, as well as lower extremities and feet. For the sake of the timing of the video and patient privacy, we did the full skin assessment before we started this video. Now we're going to go on to the head and the scalp. This head is normocephalic and it's aligned in the midline. Everything looks symmetric. I'm going to assess his scalp, looking at his hair. His hair is evenly distributed. The texture is normal for ethnicity. Color is a light blonde or light brown, dark blonde. We're going to look at his scalp, looking for any masses, lumps, tenderness, lesions, nevi, infestations, which I don't notice any. Then we're going to move along. We're going to assess his temporal arteries, which are 2+ equal bilaterally. We're going to assess his lymph nodes, starting with preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and supraclavicular. There were no tenderness noted, no swelling, so everything looks good with that. Next, we're going to assess for TMJ. So open and close your mouth. Okay, did it hurt? No tenderness, no subluxation or crepitus was noted. And we're going to look at his cranial nerve 5. So this is, I'm going to palpate his masseter muscle, clench your jaw. Okay, open and close your mouth. All right, the motor function is intact. Now we're going to do sensory. Close your eyes. Tell me where I'm touching you.
To the left in the face, to the right in the face, bottom in the face, middle or nose, forehead.
All right, his sensory function is intact. You can open your eyes. Now we're going to assess cranial nerve 7. So open your mouth. Say ah. Okay. Actually, that was wrong. Cranial nerve 7, we're going to close your mouth. Raise your eyebrows. Okay, close your eyes really tight. Now smile, frown, puff up your cheeks. Now poke out your lips. All right, cranial nerve 7 is intact. Next, we're going to look at his neck. It is aligned midline. No deformities noted. I'm going to assess his trachea. All right, can you swallow? Okay, now I'm going to assess his thyroid gland. So I'm going to move his trachea over. Now swallow. Okay, other side. All right, thyroid seems to be good. No tenderness or swelling noted there. We're going to assess his ears. So first, by inspecting, they're aligned symmetrically. Size and shape is as expected in normal limits. Going to palpate the tragus and the pinna. Make sure everything feels right. Nothing seems to be abnormal. No tenderness or swelling, deformities noted. I'm going to do otoscopic exam. I'm gonna look inside. Alright. The auditory canal is clear, the tympanic membrane is pearly gray. Next we're going to assess, we're going to do 3 different hearing tests, which for the sake of this video, just a note, I happen to leave some of my supplies at my job, so I don't have my tuning fork, which I'll need for this, so I'm just going to pretend with the motions. But we're going to start with the whisper test, so I'm going to occlude one ear and whisper, repeat after me.
Apple. Orange.
Okay.
7, 8.
Alright, so whisper test seems to be good. Then I would use my tuning fork and I would do the Weber test. I would activate the tuning fork, and for the sake of pretending, I'll use this. I would stick it on top of his head and make sure that it wasn't lateralizing to either side. We'll pretend that everything's okay with that. Then I would do the Renee test. I would activate the tuning fork again. I would place it on his mastoid bone. And I would wait for him to stop hearing it on the mastoid, and then I would come out here and let him hear it next to his ear. And as long as he could still hear it, that means that air conduction is longer than bone conduction, so that would be positive, or he would be passing the Renee test. All right, so now we'll move along to his eyes. I would inspect, they're symmetric, equal bilaterally. I would be looking at his palpebral fissures, his eyelashes, eyebrows. There's no missing hair. Everything is evenly distributed. The color is green. I would look at his sclera and conjunctiva. His sclera is white. His conjunctiva is pink. There's no discharge or lesions, anything noted like that. So next I would do test his vision. Close your left eye and read the smallest line.
LTFPH.
Alright, and then do the other eye.
The smallest one?
Yeah.
LTFPH.
Alright, so that looks good. My pen light is also at my job, so I'm gonna pretend like, well actually, I'll just use this. Normally I would use a pen light for this, and I would test his pupillary response, but I'll use this instead. Alright, his pupils are equal, round, reactive to light. We would test accommodation, so follow this. Alright, we test the 6 cardinal areas of gaze, so just follow my version of this pen light. Don't move your head, just watch with your eyes. Alright, so accommodation and convergence seem to be good. I would also use this to look inside of his eye, and we're looking for red light reflex, which was noted. I would also look at all of the internal eye structures. I would be looking at the arteries and veins inside the eye, looking for any hemorrhaging, bulging, any areas of constriction. I would make sure to look at the optic nerve and make sure that they were round, clear disc margins. Optic nerve is round, but everything looks good. So then I would move along to his nose. His nose is midline, symmetric. I would test his olfactory senses. So occlude one nostril. Tell me what you smell. Close your eyes.
Vanilla.
Yep. And then, what do you smell?
Chocolate.
Okay. It's actually cinnamon, but I think that has less to do with his olfactory nerve and more to do with my sample. Okay, so then I'd make sure that his nose was patent. I would also look with my pen light, or my otoscope, probably actually. But his nose is patent, his olfactory senses seem to be working fine. I don't see any drainage, discharge, any deformities. So then I would move along to his mouth. I would inspect. Can you open your mouth? I would look at his lips, his teeth, his gums. I would inspect his tongue, his soft palate, the floor of his mouth. Lift your tongue up. Okay. Open wide. I would want to look at his. Okay, you're good. I would look at his tonsils, just making sure to look at all the internal structures of his mouth, which nothing is noted. Open wide. Okay. Okay. His tonsils are 1+. They don't seem to be. There doesn't seem to be any redness or swelling. I don't notice any dental caries. I would look at, make sure there's, everything looks healthy with that. All right. Then, okay, stick out your tongue. Can you move your tongue up, down, left, right? Okay. There doesn't seem to be any fasciculations or, okay, you can stop. All right, everything's good with this mouth. Next, okay, I already did his neck. So then we can move on to the posterior chest. Will you turn around? All right, so in inspecting this, we're going to be looking for, again, any deformities, lumps, masses, tenderness, the usual. I'll start by testing for chest expansion. Can you breathe in? All right. Breathe in. I'm going to want to make sure that he is not using any accessory muscles, that his chest expands equally bilaterally, which it did. Want to make sure that he's not tripoding, make sure there's no nasal flaring, retractions. Want to make sure that there's no cyanosis, that he's getting good air. All right, now I'm going to palpate for tactile frontispiece. So can you say 99?
99.
Say 99.
99.
99.
99.
All right, and then I'm going to auscultate all of his lung fields. So just breathe in and out as I move this. And I would have him take deep breaths in and out in each of the lung fields, moving back and forth, symmetrically left and right. I will make sure to get the base of the lungs on both sides. I'm not going to do a full because of the timing of this video. But then I would want to do that again while he's saying 99. I would do it again with him saying E in each field, and that would be listening for egophony. The 99 would be for bronchoscopy. And then I would do it again and have him whisper. For whisper pectoriloquy, I would have him whisper 99, and I would listen again in all lung fields, making sure to get the bases of the lungs and the left lower lobe. After that, I would percuss. So go through. And percuss, listening, make sure it sounds tympanic throughout, and that there's no tenderness noted. All right, I would also, while I'm back here, I could go ahead and check for CVA tenderness. So since he's backwards, I would normally do this later when I'm doing his abdominal assessment, but I'll go ahead and do it. So tell me if there's any tenderness.
Nope.
Okay, so that's good. All right, turn around. All right, so we're gonna do the anterior chest, again, making sure everything's symmetrical, no masses, tenderness, swelling. We would assess the skin as usual. Gonna assess for chest expansion, so breathe in. Okay? Breathe in. Alright, everything's expanding normally. We would also do for tactile phragmatistic in the front with him saying 99. We can speed this up for the video. And then I would also listen to all the lung fields again. So listening, making sure he's taking a deep breath in and out in each area. Making sure to get the left lower lobe, and listening to all of the fields. We would percuss again, listening for resonance. And then we could move on to heart. So with the heart, I would listen, starting with the diaphragm, to all of the areas of the heart. I would do aortic, pulmonic, aortic, pulmonic, Erb's point, tricuspid, and then mitral. Then I would do it with the bell, so aortic, pulmonic, Erb's point, tricuspid, mitral. And this is the point of maximum intensity. I would feel, make sure there's no thrills. I would also listen here for a full minute. I'm not going to do that because of the time of the video, but I would listen for a full minute. This apical pulse, it's the point of maximum intensity, and I would then make sure to note the rate. We'll pretend his rate is 64. He's a healthy young man. And then the rhythm would be normal sinus rhythm. I would also note that there were that S1 and S2 were heard. There were no extra sounds, no murmurs. So then, all right, I've already felt for that. So then come over here and lay down. Okay, we're gonna keep you, first we're gonna do like a 30-degree angle, or like scoot down a little bit more. All right, this is not quite 30, but that's okay. All right, so at a 30-degree angle, we would be looking for any heaves or lifts. I'm making sure there's no jugular vein distension, which none is noted. Okay, go ahead and lay all the way down. So with him laying all the way down, I would do the heart, listening to the heart again in all the areas. So I would do aortic, pulmonic, Erb's point, tricuspid, mitral. I do it with the diaphragm and the bell. Listening again, making sure the sounds are all normal. I would also palpate and feel all those areas, making sure there's no thrills. When he's laying, I would move along from the heart onto his abdomen. His abdomen is flat. There's no bulges, no deformities noted. I would start by auscultating. I would do his abdominal arteries. So I'd listen to his aortic artery. I would do renal, iliac, and then femoral. Making sure there was no thrills there either. Then I would listen to all four quadrants of his abdomen. I would start with the right lower, right upper, left upper, and left lower. I would listen to each area for a full 2 minutes so that I could make sure to hear good bowel sounds and determine if he's normoactive or not. But obviously I'm not going to do that for a full 2 minutes. So then after I auscultated, I would palpate all four areas. Again, right lower, right upper, left lower. Make sure there was no tenderness or masses noted. And then I would percuss the areas in the same manner, and I would make sure that there was no tenderness or masses noted. I'm listening for tympany throughout. I would expect that there would be I would make sure to do the spleen and the liver, expecting dullness over the liver and resonance over the spleen. Tympani over the spleen. Okay, you can go ahead and sit up. So then you can go ahead and sit back down on this. We would move along to musculoskeletal. Let's start with his hands. Put your hands out. I'm going to inspect his fingers, hands, wrists, elbows, shoulders, looking for any swelling, any redness, tenderness, any nodules, feeling again for temperature, texture, all of that. I would also check for cap refill, making sure that it's less than 3 seconds. I'm looking for edema as well. Okay, so now we're going to do the motions of your hands. Starting with your fingers, this straight out is extension, so do flexion, extension, hyperextension. With your wrist, do the same, flexion, extension, hyperextension, rotation, ulnar deviation. Wait, I think that's radial. No, ulnar deviation, radial deviation. All right, now we'll do your elbows. So you can have them out. This is extension, flexion. That's extension again. Hopefully you don't hyperextend. All right, that's expected. Then do your shoulders. So this is just regular extension, I guess. I can't remember the words for these right now. I'm blanking. So you go extension. Just follow my motions. Go down, but make sure this is hyperextension actually. And then adduction, abduction. I can't remember. Okay, anyways. I'm also making sure there's no crepitus or anything noted in that. He's got full range of motion. All right, go ahead and, okay, we'll test your strength. So squeeze my fingers and test for grip strength. Good. All right, put your arms out like this. All right, push against my hands. All right, now just pull, okay? Then with your shoulders, put your arms out. Okay, push against my hands. All right, now push. All right, that's good. Also, we want to test shoulder girdle, so push up against. All right, he's good strength. Stand up. We're going to assess his lower extremities. So we're going to start with his hips. Put your leg out to the side. All right, back. You can do circles. All right, do your other leg. Go out this way, out to the side, crossover, circles. And then also twisting it like that. All right, other leg, we can do that. Okay. So for your knees, this is just extension. So flexion, extension. Hopefully your knees don't hyperextend. Same with your other leg. All right. And then sit back down. Do your ankles. So push your feet down, out, up. All right. And then your toes. Can you do your toes? Up, out, down. Can you spread them out? All right. Now we will test the strength of your legs. So push against the hand. All right, back. This one, back. And then with your ankles, push against my hand. All right, and push down. All right. Then I would test his reflexes, which I don't have my hammer because it's at work. So we can use this. Put your arms out. All right, and then test his, just relax. Test your reflexes here. Brachio. All right, this is not really working because I don't have a proper hammer, but I would test all of his reflexes. And Achilles, and then I would test for his Babinski, which again, this is not really working very well. Okay, I think I also would test his, for stereognosis and graphesthesia. So close your eyes. All right, put it on your hands. Can you tell me what that is?
Can I back pull
Yeah,
my
feel
hand?
it.
Fingernail clippers.
Okay. What is this?
Tweezers.
Okay, that's good. Now, I'm gonna write it, close your eyes. Tell me what I'm writing on your hand.
8.
Okay, let me see this hand.
X.
Okay, that's good. All right, so stereognosis and graphesthesia are intact. Okay, stand up. We're gonna test your, I can't remember, but it's okay. All right, can you walk in a straight line with your feet one in front of the other? All right, come back this way. All right, now can you hop on one foot? All right, other foot. All right, that's good. Now sit down. And one thing I forgot to do earlier, we're gonna test do this with your hand. Like this. All right, and do like this. Okay. And then touch your nose with your hand. And then touch my finger. And then touch. Go back to your nose.
No.
Go back to my finger. Nose. Okay. Okay.
Can I look at it?
Yeah,
There it
you
is.
should look. Okay. All right. That is all I can remember at this point. It's the best I can do right now for my head to toe assessment. Thank you, Wyatt. I appreciate your